Welcome to First Star Let's Chat, an athletic therapy podcast. I'm your host, James Gardner, certified athletic therapist, certified strength and conditioning specialist, yoga instructor, human being. This platform, for the pros, by the pros, anybody in the performance space, and beyond. Welcome here to share in the stories of professionals, experiences, journeys, learning along the way. It's a platform to connect, to network, and to be a part of a community that cares, with conversations that matter, experiences that resonate, and generate ideas, thought-provoking, organic dialogue, passionate pros. Brought to you as always by First Star Therapy, Mobility Tape, Epic, and Benchmark Athletics, in association with the Canadian Athletic Therapists Association. It's First Star Let's Chat, an athletic therapy podcast. Thanks for being here. Thank you for being a part of it. Here we go. Recording from the exhibitor hall here in Tel Aviv, World Congress 12, 2023. We're in Israel. We have had the honor of listening to some of the great speakers. Some really great speakers, some really great guests and conversations when it comes to international delegates. Here with me today is Eric Fuchs. Eric, appreciate your time in sitting down and carving in a little extra time.
Thank you.
Dr. Eric Fuchs is a professor in the Athletic Training Education Program in the department newly named of Parks, Recreation, Exercise, and Sports Science at Eastern Kentucky University. He's authored a textbook chapter on emergency medication administration. He practices clinically as an athletic trainer, assisting with football coverage at EKU, and serves as the Director of Sports Medicine for Festival Sports, Inc., and as a member of the Kentucky Board of Emergency Medical Services Task Force. So that's not even all of it.
Yeah, exactly. I have a few hats.
Yeah, a few hats and some different areas when it comes to training and the interaction that you have as an ATC, as a professor, and in this space. You had the opportunity to present here as well. So let's just start with your journey. Where did it begin in athletic training, and where are you now?
Athletic training started when I was in high school. I was an athlete. It's probably a stereotypical story as far as I got injured, met our high school athletic trainer, liked the field, liked the medical field, started looking at programs. I went to Ohio University for a bachelor's degree. Back then it was a bachelor's degree. Things have changed. I was fortunate to have some incredible mentors there at Ohio University. And then from Ohio University, I went to a post-professional master's program at San Jose State in San Jose, California. That's where, ironically, I started working as a GA for this volleyball tournament that turned into now going on 30 plus years working with Festival Sports. And now I'm the director of that. I did clinic outreach out there for a while and decided I did not like the clinic setting, and I went full-time in the high school setting. And I took a job in Albuquerque, New Mexico, and then Santa Teresa, New Mexico, which is southern New Mexico. That's where I became a clinical instructor for students, and I really liked teaching students. I said I want to work at the college level with students. So I went back as a head athletic trainer at Rose State College in Oklahoma City. And then from there, I realized I really I liked the teaching part as well. So I had to go back for my doctorate, did my doctorate at Middle Tennessee State, then took a job at Tusculum College after that. And then Bobby Barton, who is a two-time NATA president, actually Kathy Derringer, who you've had on your show. She was a grad assistant while Bobby was the president of the NATA at EKU, but he called me up and recruited me to come there. And I've been there for 18 years since.
Unbelievable journey. And if nothing else, athletic training has allowed you to travel. Maybe not with the foresight of coming to be part of a World Congress in Tel Aviv,
but here we are, and
Here.
you're sharing knowledge globally now. We're sharing knowledge, your wisdom, your passion projects, your research, all the things that you're doing on a global stage with students that are coming out into essentially a brand new profession here in Israel.
Mhm.
But you're also sharing it amongst some of the leaders in the field from North America, Ireland, UK, and what a special place to be. And again, the background noise, intentional, we're in the exhibitor hall. Your presentation here, a workshop on best practices in acute dislocations. Give us a little rundown on that, and we'll go from there.
Sure. So the presentation is, I mean, I called it "Are you in or are you out?" and are you going to do acute?
A great name, by the way.
Yeah. You got to have a clever title to attract people, right? You're on a world stage.
This is it.
It's designed to teach people what are the best practices to reduce the joint when you have that acute injury, whether it's an elbow, whether it's a knee, whether it's a shoulder. And we see that a lot in sports, especially, you know, it's a very common injury, but getting those reduced, if you look at the literature and the evidence, which is what I present, it's a better patient outcome for your patients. And the sooner it is reduced, that outcome is improved. Plus, it saves money, it saves time,
right?
And the person, if it stays out and it gets locked up, they may have to go to the hospital and undergo anesthesia, general anesthesia, which can bring its own risk. So it's a skill set that in the U.S. athletic trainers have been doing for years, and I put together a workshop because the CIDN, our accrediting body of our programs, finally put it in our educational standards. And I realized some people are probably going to want to know how to do this, educators as well as clinicians, and that's how it came about.
Yeah, an amazing capture and using simulators and doing these things that some of the tech is up and coming, new-ish, but also evolving constantly. And you talk to response time and the early response to a dislocation and acute. We just had Kathy on, and we were talking about the Damar Hamlin incident and the response time of the ATCs to a cardiac arrest. What a broad scope we have, you know, in terms of response and what we're doing. I know you've worked with some pretty unique environments in terms of teaching. Outside of this delivery and EKU, where else have you been as an ATC teaching tactical things or technical components of what you do?
So I also am an adjunct faculty member in the Center for Wilderness Medicine and Outdoor Public Safety, because I also have an EMS background, and I do wilderness rescue, rope rescue tech stuff. So when you read my bio, it talks about K-Beams Task Force. They were creating the ISBC was creating the international standard for a wilderness paramedic certification board, and I was tasked with that task force to be the subject matter expert on joint reductions and fracture alignment, because that was the orthopedic piece. Even though I have the EMS background to understand what they have. So in those areas, I take some things from that and I put it into my presentations in AT, and things overlap. And I've done that with other presentations that I do, whether it's IV administration and things like that, because athletic trainers in the States can do a lot of different medications and things.
And that's one of the themes here, right? Like seeing where and how this profession can fit.
Yes, and I think one of the things about the Israel Association just starting is they're realizing they sort of do need to lay out a scope of practice. And when I was having a discussion with one of their leaders, I said, but you need to make sure it's tied with your education. Learn from us in the US, where our standards kept changing, and then we had to go back and fix the scopes and within the States. So there's a balance there, but it's really neat to see that where they are and know where they can go.
Yeah, and we're trying to capture a little bit of that, a little bit of the vibe here from Tel Aviv, a little bit of the vibe from World Congress. I'd love to have you on again where we can sit and have a nice long conversation about all the things you've done and how you got there, because that's really important for everybody to hear too. This isn't one way to do it. There's not one way to do it that's going to make sense to everybody, but sharing your story and everything you've done, really, really grateful for any time that you've provided with not just this conversation, but the presentation and everything you've contributed to the field. And some takeaways quickly, just to wrap, from this being here.
I think being here has been great. It's neat to see how the profession's evolving globally, and making connections with other professionals and students has been great. I mean, and learning about the differences and how can we work together, because, sport is one of the things used to help with international relations between countries.
That's a great
If
point.
this grows, how many other interactions and we're in Israel, of all places, but we talk about, the need for connection of other countries and relationships that could bring about maybe some more peaceful environments.
Yeah, amazing. And the true capture of what sport is and can be sort of aligns with what athletic training and therapy is and can be. There's a broad scope, and you've touched on so many points already. I'll just leave maybe the last word to you in terms of what does this mean to you? What does this mean to the profession?
I mean, to me, it's an opportunity to present on a world stage and make more connections, even for my students and my colleagues back home. And it's been an incredible honor. I submitted an abstract because I had a content area that WFAT was looking for, and I wanted to get involved on the international level, and it's worked out. It's been a phenomenal experience. I highly recommend WFAT to others out there.
Yeah, and we really appreciate it. I appreciate it. This is a connection started 2 days ago. We've had lots of great conversations, formally, informally, and just to see you around and be able to approach, shake hands with experts and share the field, share the passions, share all of the learning with people and organizations that are just starting out. So again, it's Dr. Eric Fuchs. She's at Eastern Kentucky University. I'll get your word that you'll be on again.
Yes,
Awesome.
I will gladly be on another podcast in the future.
Amazing. So for everybody listening, thank you so much. We are live in the exhibitor hall here in Tel Aviv, World Congress 12. It's Let's Chat. It's the official podcast of WFAT. We're signing off for now, but it won't be the last. Eric, again, thank you so much.
Thank you.
Thanks again for being here. Thanks for listening. Thanks for being a part of this community. Check us out online, firststartherapy.com. That's FIRSTAR therapy.com. Or email us with feedback, consult@firststartherapy.com. CONSULT@firststartherapy.com. On Instagram @firststar.therapy, and our podcast host @letschat.at. This is First Star Let's Chat, an athletic therapy podcast.